Hello everyone and welcome back to the GuideWell Connect Insights Lounge. We're here at day one of the AHIP Institute and Expo. Everyone, my name is Kate Warnock and I'm so happy to bring with us our new guest, Tom Kornfield. Tom, welcome to the interview.
Thank you very much. Lovely to be here.
Oh, happy to have you. So Tom, you are Vice President with Avalere Health. All right, first question for you. You have an extraordinary background in public and private sectors of the health industry. I mean, really, truly phenomenal. I hope that folks look you up on LinkedIn. You have a lot there.
I hope so too, right? I do.
With that perspective, share the ways that you think the consumer health status might benefit in the post-election season.
So my sense is that consumers will really benefit from the focus on value, and I think that's going to occur in a number of different ways. Taking a step back, the macro legislation that I'm sure a lot of folks will talk about
Andrew was
here.
just talking about
right,
that, yep.
And I'm sure, you know, and I won't list out the acronym, and of course in Washington we love acronyms. But essentially that legislation really is kind of moving the train down the tracks, if you will, towards value for provider payments for physicians. And I think that that's going to benefit, in a post-election environment, I think you'll still see that focus take place. I mean, thinking about how the legislation came together, you know, in this Congress that obviously has had some difficulty passing legislation, but was able to move that forward. And so I think the value piece, I think, is going to continue to move down. And where I think that's really going to help consumers is in terms of really providing them, I think, better care, and the providers themselves will, I think, be more accountable than they've been in the past. I think to some degree there's just been a lot of discussion and talk about what value means and, you know, how it's important to pay for value, but there haven't really been teeth in it yet.
Right.
And I think that MACRA really sort of ties that in a directed kind of way, and consumers, I think, will benefit from that just by virtue of, you know, being able to have their providers really focused on, you know, whether or not this is the right kind of care being provided, as opposed to just providing care just for the sake of being reimbursed because it's a test that you get.
Do you think, okay, so value-based care is such a, it's not just a buzzword, there's real meaning to it, but do you think we're years out from having a sea change that we hope it will bring, or are we really heading in the right direction sooner?
So I think we're heading in the right direction. I think that, you know, it's going to come up pretty quickly, and I don't know how well providers are situated for that. So I think that's going to be a challenge. So 2017 will be the first year of reporting for MACRA, and I think that that's going to, for some providers, I'm not sure if they're quite ready yet for that change. So, you know, it could be that we may see some activity, you know, towards the end of the year around some of the reporting requirements that CMS has laid out. CMS has put out a proposed regulation. I think they'll put out the final regulation, you know, presumably before the election season. It probably depends on the sector as well. I think some aspects of the health sector may be better suited for it just by virtue of having better data, and other sectors, I think, may not be in as strong a position. And then I think health plans obviously have a pretty important role to play as well. And I think to some degree they've been very, very forward-thinking, I think, in terms of how they've done the value-based payment arrangements. Although I think that story is one that really needs to be told. And I think plans need to start telling that story in order to kind of get out in front of it. Because I think they are doing a lot of great work, but I don't know that that story is sort of resonating right now with the public.
So do you think that the public is ready to hear that story from the health plan, or are they more receptive if they're going to hear it from the provider, the one who's hands-on delivering that care? Is that a challenge?
I think it's always a challenge where the provider is really the trusted source of the information.
Sure.
But having said that, I think that the plans themselves can be seen, well, a couple of pieces to it. One is, I think, the plans understanding the way consumers see them and maybe working with consumers to help them understand other ways that they provide services to them, and, you know, educating them and, you know, really providing them what they need. But it's obviously a very close partnership with the providers. The providers are the front line with the patients. But I think behind the scenes there can be some, you know, payment arrangements that are done between the plans and the providers that really sort of help move the ball down, you know.
You know, we just had, that was a great response, not to cut you off. We just had Andrew Davis on with Medica, and he was talking about how Medica's employees really identified one of the ways to really kind of break through to the member is to simplify the talk. Take
Absolutely.
out the acronyms. You were just talking
Right.
about
I
how
was talking about the
Washington loves the
acronyms.
acronyms.
We do.
We need to simplify the language, and maybe that's
Absolutely.
the right place to start to then tell that story.
Well, I think right. I think, and there's a lot of literature around about beneficiary difficulty in understanding materials
Sure.
being provided, whether it's from health plans or from the government. And I think you really need to think about what's important to the consumer, what matters, and focus there, and start the conversation in that way, and not really try to obfuscate or make something more complicated than it needs to be. I mean, I think a lot of these, and I think a little bit about. So I was listening to. So the area I work on is risk adjustment, which is fairly complicated and can be very involved. I was listening to a podcast with Adam McKay, who directed The Big Short, and I've also read the book. And in thinking about that book and thinking about what he was talking about, it's sort of, I think one of the ways that movie was so successful was in simplifying what seemed like this incredibly complicated, difficult endeavor. And I don't think that we in the healthcare industry do ourselves a good service when we make something more complicated than it needs to be. So I think that effort to simplify that effort and really kind of look for best practices around ways to best communicate information to consumers, to really show them what is happening. And I think also understanding what matters to consumers. So, if you're trying to have a conversation with a consumer and you talk about something that's not really, doesn't resonate with them or isn't really important, that's probably not an avenue you should go down, or you should, shift your strategy more around, what really matters to them. And clearly, I think to your point about the providers are a critical part of that equation, and plans need to, be closely aligned with them. And it could very well be in some markets that Medicare Advantage is, sort of ahead of the curve relative to where fee-for-service is, even with some of the macro changes. And I think, again, that's a story that needs to be told, and providers would be an important piece of telling that story.
And I'm so certain that here at AHIP we're going to be hearing all sorts of conversations just around those themes. So I'm so glad that you're helping to kick this off for us as folks know what we're going to be speaking about. So another question for you, and I think this is a challenge here.
Right.
We're going to pivot a little bit.
Okay.
So we know the skyrocketing costs around prescription drugs. Is there a silver bullet for this cost rise this J curve that we're seeing? And what role do you think public and private sectors will play, if so?
So I don't know that there's really there are very crude ways to control healthcare costs, and I think those have and as a result very kind of strong negative impacts on consumers and on the healthcare industry. Obviously, any area that's growing at a rapid rate or a rate higher than other areas gets a lot of attention, and certainly prescription drugs fall into that category. Certainly, it's been in the news with various the
characters. We have some real characters.
The pharma bro, or however you want to call them, and I think that gets a lot of attention. But having said that, I think that the value piece of this equation is really critical again for driving how we can address prescription drug costs. So, if a new drug is coming out to market, and how it compares to existing drugs, and does it really provide better value, and I think that's a critical piece should be a critical piece of the equation in terms of how we look at it. I think if we're not able to really, it's difficult because you can't just sort of say no to everything. I mean, at some point, the industry needs to be able to think about what are some solutions to the problems, not just we don't like this answer, we don't like this answer, we don't like this answer. I do think that value provides some opportunity towards that, but I think it's going to be a significant challenge. Obviously, it's gotten a lot of attention from both presidential candidates,
right?
And I think we'll continue to see a lot of attention after the election, and it's a hard problem to solve because there's so many different impacts that could happen. But absent some kind of, and I think MedPAC is out today with their report to Congress, and they've talked about changing the way the Medicare pays for the sort of the catastrophic costs of the benefit and shifting more of that risk, I think, onto plans. And that could result potentially in some impacts on the premiums for beneficiaries. So absent some other kind of change, I think that's looking at, a sort of more, this drug, how does it compare to that drug? And, are we really paying appropriately for the value of that drug?
Right.
I think we're going to be faced with these kinds of, sort of crude changes that are just, instead of the government paying 80%, the government pays 20% or something like that. And that's a little easier to some degree for policymakers to identify as saving the government money. but it has a lot of potentially negative impacts that I don't think have been fully explored to date.
I want to get your thoughts on this particular question, Tom. So Guidewell Connect is based out of Florida, and I know that in the 2017 legislative session, they're going to be talking about step therapy, regulated at the state level.
Right.
And I think that there's really a parallel from what we were talking about with value-based care and making that description, making the language easy to understand. Can we maybe accomplish the same thing with efficacy? So if we have drugs that are in the market, they're proven and reliable and safe, if we are able to explain the efficacy behind it, does it maybe make the case itself for maybe not going to the brand new drug that is on the market, and still having that step therapy in place? Is that clarity around efficacy, is that maybe a way to begin this conversation?
I think that's one piece of it. I think the prescription drug companies and the plans working together on these issues, I think is a big part of why I think some of this is very challenging. But I think if they're willing to be able to work together in kind of a collaborative way, I think it's more likely that they'll get an obtainable outcome. And the efficacy, step therapy, and these are all different ideas that I think have been around. And the unfortunate fact, I think, as you're saying with Florida, is that there starts to be legislation when the activities aren't, the private sector isn't sort of doing what it needs to do, if you will, to control costs in such a way that it's not getting the government's attention.
Right.
So, I think it behooves everybody within the industry to really work together to try to address the issue, because it's something where you may not like the answer that's provided to you, and and it might just kind of be that it gets a lot of attention in the media, and it gets there's I think a lot of popular support for addressing drug pricing.
Right.
Right.
Well, Tom, I mean, you have such a wealth of knowledge, that you bring here to AHIP Institute, and I'm so grateful that you joined us here for a moment at the Guidewell Connect Insights Lounge. Thank you so much for joining us.
Thank you so much for having me.
Yeah, all right. Well, my name is Kate Warnock. We're going to be up live with another interview in just a moment. Keep watching.